So now coming to the second part of the GIT system. Now in second part we are going to complete the anti-emetics. Then we are going to study about the prokinetic agents. Okay. Then we have drugs used in diarrhea and constipation, and also drugs which are used in irritable bowel syndrome and inflammatory bowel syndrome, both IBS. So why I've divided this into two parts, because this part, although it looks small, but there are many new drugs which have been brought in this field. So I couldn't do justice to whole of GIT in one video, so that is why I decided to break it into two. So now let's start first with the antiemetics. Okay, so in antiemetics, now what are the different types of vomitings that usually questions are asked upon? So we have motion sickness, that is one type of vomiting. Then we have morning sickness. Okay, the normal vomiting is there. Then we have chemotherapy and radiotherapy induced vomiting, right? So we have various types of vomitings, and then we also have post-operative vomiting. So what are the drugs which are used in these various types of vomiting? We'll be seeing that. If I show it on a diagrammatic picture, so this is the vomiting center. Now we are going to see what are the neurotransmitters that play a role in vomiting, right? So now this is the vomiting center. The stimulus from GIT comes via 5-HT3. So one stimulus comes via GIT. From the GIT, suppose some poisoning or something is there, then the body doesn't accept it, or there's a infection in the GIT, then it induces vomiting. So that is there. Then there is a CTZ center. Okay, chemoreceptor trigger zone. Now the neurotransmitters which play a role here are D2, NK1, and 5-HT3. So these are the neurotransmitters which stimulate CTZ. Okay, then we have a vestibular system that is related to our ear. And we have vertigo or disturbances in this vestibular system also result in vomiting. So there the receptors which play a role are M1 and H1. Okay, so they also go and stimulate this vomiting center, and so they play a major role in the motion sickness. Okay, so now what are the major receptors or major neurotransmitters? One is serotonin, and that is 5-HT3. Okay, then we have dopamine, that is D2. We have NK1, okay, and we have muscarinic M1 and histaminic M1 receptors also. So these all receptors, they play a role in the vomiting. So naturally the drugs which will be used in the vomiting are going to be based on these receptors, right? So now let's see one by one what are the drugs that are used in different types of vomitings based on these receptors or neurotransmitters. So the first vomiting that we are going to see is motion sickness. Now motion sickness mein we give hyoscine. It is given intramuscularly, or it can be given as a transdermal patch, okay, for prophylaxis. Like somebody is traveling somewhere, so they can take this patch. Then we give antihistaminics. Antihistamines are given for motion sickness, like promethazine or diphenhydramine. Then cyclizine can also be used. Then there is a very specific drug we had earlier also studied in histaminics, cinnarizine. This is used in vertigo. Okay, so these are the drugs which are used in motion sickness. Next we come to morning sickness. So in morning sickness, now you all know morning sickness is associated with pregnancy. So the drugs which is most commonly approved, doxylamine plus pyridoxine, that is vitamin B6. They are the safest drugs in pregnancy. Apart from that, if you use D2 blockers, then they are teratogenic, so they are not used, right? So in morning sickness, we don't have much choice. We can use doxylamine plus pyridoxine, B6, that is the safest drug. Then we have chemotherapy or radiotherapy induced vomiting. Now in chemotherapy or radiotherapy induced vomiting, the first category of drugs that we use is 5-HT3 antagonist, okay, 5-HT3 antagonist or 5-HT3 blockers. And in this, in the chapter of serotonin, I have completed them very in detail. We have ondansetron, we have granisetron, we have dolasetron, we have pelonosetron, ramosetron. So a lot of these drugs are there. Now in this, pelonosetron is the most potent drug, okay, and dolasetron causes it prolongs the QT interval, so it is not a very safe drug. Okay. Then these drugs can also be used in hyperemesis gravidarum, and they can also be used in post-operative nausea. So ondansetron and these drugs can be used there also. Then we have a drug that is cisplatin. Now cisplatin induced vomiting, इस पे बहुत सारे questions आते हैं. A lot of questions are asked on this cisplatin induced vomiting. Now इसमें please remember that if it is acute, that is less than 24 hours, then you give 5-HT3 antagonist, and if it is delayed, like after 2 days, then the drug which is used is aprepitant, which is basically an NK1 receptor antagonist. Okay, if you remember in NEET 2024, they asked about this aprepitant also. So this is aprepitant. Now there is a drug for aprepitant also. It is a prodrug of aprepitant. It is given IV. It is orally active and it interacts with CYP3A4 enzymes. Okay. Another drugs of this category are Netupitant, which is a new NK1 antagonist, and we have Rolapitant, which is also used in delayed vomiting. Then there is another category of drugs which are called as cannabinoids. Okay, now cannabinoids basically in this tetrahydrocannabinol is active principle of these cannabinoids, and इसमें drug है dronabinol, which is used in cannabinoids. Active principle is tetrahydrocannabinol and the drug is dronabinol, which is used in refractory vomiting. So any vomiting which is not responding to any other drug, you can use dronabinol, which is a cannabinoid, and that can be effective. Okay, then other drugs which can be used as antiemetic. So here we have steroids like dexamethasone. It has also got emetic effect. Then in benzodiazepines we have alprazolam and lorazepam, right? So these are some drugs which also can be used. Another important thing about cannabinoids, I've forgotten, like cannabinoids, dronabinol is also known to stimulate appetite. So it is used in HIV-induced anorexia. Okay, so please remember this point about dronabinol, that it is a cannabinoid and it is used to stimulate the appetite also. So these are the drugs which are used in MSS. These are the drugs which we have studied about, which are playing a role in vomiting, right? Then there are some compounds, just to name them, I'll say that there are some emetics in which we have apomorphine and epicac. And emetics are mainly used in poisonings to basically remove the toxic material from the stomach, but they are contraindicated in kerosene poisoning and corrosive acid poisoning. This is a very important point, that they are contraindicated in these two things. Okay. Now next we come to gastroesophageal reflux disease. So what is GERD? GERD is a disease where there is basically like, as you know, this is the stomach. So there is increased acid production, right? And decreased forward movement. And the third thing is relaxed lower esophageal sphincter. So these are the three pathophysiology, pathogenesis in GERD. So the treatment modality focuses on decrease the acid production. Okay. So for that we have proton pump inhibitors and increase the forward movement and also close the LES. So for this we have prokinetic agents. Okay. So let us see what are prokinetics. What are the various types of prokinetics? Let us see. Now the various types of prokinetics. What are the receptors? First, again, let's understand what are the neurotransmitters that play a role here. Though it is seen, सबसे पहले, you know that acetylcholine causes peristalsis, right? So acetylcholine is an excitatory neurotransmitter, and so we should give drugs which will increase the acetylcholine action. Okay, so we should be giving drugs which increase the acetylcholine. Secondly, serotonergic also, it causes diarrhea and propulsion, so we should increase the serotonin also. Okay, so the serotonin which plays a role here is 5-HT4. Then 5-HT3 serotonergic में आता है, 5-HT3 inhibitory होता है, तो we have to use drugs which will reduce 5-HT3 or which will block 5-HT3. ठीक है. Then there's another D2 from presynaptic receptors. It also reduces the motility, so we have to use drugs which will also inhibit D2. तो इसका मतलब क्या हुआ कि to increase motility we give cholinergics, we give 5-HT4 agonist, ठीक है. Then we give D2 antagonist and we give 5-HT3 antagonist. So these are the various drug targets by which prokinesis can be achieved, by increasing the cholinergic pathway, by giving a 5-HT4 agonist, by giving D2 antagonist, and by giving 5-HT3 antagonist. So these are the various pathways by which we can produce prokinesis. So let us see the drugs one by one. Now, the first drug that we are going to study is metoclopramide. Okay, this is a very famous prokinetic drug. It has got a central and peripheral D2 action, and by the central action it produces anti-emetic. ठीक है. ओके, प्रोकाइनेटिक एक्शन क्यों करती है? प्रोकाइनेटिक करती है क्योंकि ये 5-HT4 एगोनिस्ट है, एंड इट इज ऑल्सो 5-HT3 antagonist. Okay, these are the two actions. Okay, so this is, I'll say first, this is, I'll say second, then it has got third action, that is it increases acetylcholine. So it can be, the actions can be inhibited by atropine also here. If somebody is giving atropine, then metoclopramide action will be reduced. Now what does it do? It increases the peristalsis, it increases the LES tone, and So it is very commonly used as an antiemetic agent in GERD and also gastroparesis. Then it is also used to empty the stomach for emergency anesthesia when the patient has taken food less than 4 hours. Less than 4 hours mein khana khaya to. Then these drugs, because of their D2 action, they have extrapyramidal symptoms. So they can produce Parkinsonism, and they can also result in hyperprolactinemia and galactorrhea, right? So because it is acting as a dopamine antagonist, blocking dopamine, so it can result in Parkinsonism and it can also result in hyperprolactinemia, right? So this is one category of drug, metoclopramide, which is used. Then let's go on to the other category of drug, which is used as a prokinetic agent, and that is 5-HT4 agonist, which is cisapride, mozapride, renzapride, then prucalopride, etopride, cinetapride, and a very important new drug, that is pegaserol. Okay, now सबसे पहले तो अपन पढ़ते हैं cisapride के बारे में. Let's see this cisapride. Now this is very like क्या बोलते हैं, बदनाम drug, because it causes long QT syndrome, especially when given with ketoconazole and erythromycin. Okay, so this is a major problem with this drug. So cisapride now is almost not used. These drugs, they have no action on D2 receptors. Okay, very important, and they increase the whole GI motility. Okay, cisapride ये करती है, बाकी mozapride, renzapride, they do not cause any prolongation of the QT syndrome. Then tegaserod is used for constipation with irritable bowel syndrome, but this tegaserod is now withdrawn from the market. Why? Because it had a tendency to cause MI and stroke. So this is something very important, that tegaserod was used for constipation with IBS, but now it is withdrawn from the market due to myocardial infarction. Then some other drugs also are there which cause prokinesis, and in that we have one drug which is called as levosulipide. This is actually an L isomer of sulpiride, which is an antipsychotic drug, and it is also said to have prokinetic action. Then another drug is loxyglumide, which is a CCK1 receptor antagonist. So this drug is basically used in constipation, dominant IBS, irritable bowel syndrome. Then we also know that macrolides, these are antibiotics like erythromycin. Okay, so these drugs also, they stimulate the motilin receptor, and so they also increase the motility. Okay, they are mainly indicated in diabetic gastroparesis, right? But there's a very rapid development of tolerance, so they're not very successful here. So these were the prokinetic agents. Okay, now in the same prokinetic agents में ही हम पढ़ते हैं irritable bowel syndrome. Now irritable bowel syndrome is basically a disease. It is basically called as a psychosomatic disease, which is characterized by abdominal pain, plus there is either diarrhea or constipation. So some patients have constipation dominant IBS, some patients have diarrhea dominant IBS. Okay, now so pain, what you can give the normal antispasmodic drugs like dicyclomine can be given, dicyclomine, hyoscine, they can be given, or in very severe cases then you can give tricyclic antidepressants. Then another drug that can be given is mebeverine, which is also an antispasmodic. Okay, now let's see diarrhea dominant IBS. Now diarrhea dominant IBS is managed by loperamide. This is an opioid, and this has a tendency to cause constipation. We all know about this. Newer opioids have come in the market, and what are their names? The newer opioids are called as fedotozin, then eluxadolin. These are newer opioids. Then we have 5-HT3 antagonist, in which we have allosetron and we have cilancetron. They also can be used. The only adverse effect that they cause is ischemic colitis. So this can be the adverse effect of these drugs. Then let's see the constipation dominant IBS, right? Now constipation dominant IBS में the drug, सबसे पहले तो it is tried that the patient takes dietary fiber and laxatives. Okay, then another drug that we can give is lubiprostone and linaclotide. Then now there is a new drug. What is that new drug? It is tenofovir. This is basically inhibitor of sodium hydroexchanger 3 in the intestine. Okay, now this sodium hydroexchanger, this basically helps in absorption of sodium ion in GIT, right? And when we inhibit this, there will be increased sodium ion in the lumen, sodium ion levels in the lumen, which will cause water secretion, and then it will make the stools soft. Okay, so this is the mechanism by which this drug acts, but it is contraindicated in children less than 6 years of age, and this is approved for IBS with constipation. Okay, so ये तो थे हमारे IBS से related treatments. Okay, अब हम आते हैं constipation पे. Now constipation or diarrhea specifically. Now constipation में the drugs that we give are laxatives. Okay, laxatives में there are some which are called as stool softeners. Now इसका जो classification है ना, ये ध्यान से देखना बहुत जरूरी है. So we have drugs which are called as stool softeners, in which we have docusades, we have liquid paraffin, okay, and we have mineral oil. Then we have drugs which are bulk forming agents. Okay, so bulk forming agents में we have dietary fiber, bran, psyllium, and methyl cellulose. Okay, then we have osmotic diuretics. Now in this we have saline laxatives. Saline laxatives are magnesium sulfate, magnesium hydroxide, and sodium phosphate. Okay, then we have non-digestible sugars, which will basically have an osmotic effect. So non-digestible sugars may we have lactulose, then we have lactylol, sorbitol, and we have mannitol and polyethylene glycol, which is PEG. Okay, then another classification is stimulant purgatives. They are called as purgatives because they are used in purgation. Here we have diphenyl methanes. In this we have bisacodyl, we have sodium picosulfate, and we have phenolphthalein. Okay, then we have anthraquinone derivatives, in which we have senna, and we have cascara, and then another category we have is castor oil. Okay, and then we have another category, and these drugs are called as prokinetics. Constipation में हम prokinetics भी तो यूज करते हैं. So उसमें हमारे पास 5-HT4 agonist आते हैं, जैसे mosapride, renzapride. तो one drug is prucalopride. Okay, then we have D2 antagonist like metoclopramide and domperidone, which are used here. Then we have macrolides, in which we have erythromycin. Okay, so these are the drugs which are used for. This is the complete classification of drugs which are used in constipation. You remember this classification very well. So there we have bulk forming, then we have stool softeners, we have osmotics, in which we have saline laxatives and non-digestible sugars. Then stimulant purgatives are there, which are of anthraquinone and diphenyl methane derivatives, and prokinetic agents. So these are the drugs which are used in constipation. Now we take diarrhea. Okay, so what are the drugs which are used in the treatment of diarrhea? Now diarrhea में सबसे पहले जो ड्रग मैंने अभी आपको पीछे भी बताई है, that is opioids, which is loperamide. Okay, so loperamide is one drug which is used. Then there is another opioid which is diphenoxylate, and please remember diphenoxylate is combined with atropine. Why it is combined with atropine? To prevent abuse potential. Okay, now these drugs, opioids, they are contraindicated in infective diarrhea because they will increase the infection and that can result in intestinal perforation also. Okay, so that is about opioids. Then the second drug which is normally also used is octreotide. Now octreotide is a somatostatin analog, right? Now this we have also studied. Achha, we have to do the endocrine system. It is used to reduce the secretory diarrhea. It is also used in carcinoid syndrome, in which there is diarrhea due to excess of serotonin. Also used in VIPoma. Then in low doses it stimulates motility. Okay, and in high doses it inhibits the motility. So you should remember this about octreotide. Then it is used in high doses. It is used in treatment of vagotomy, then short bowel syndrome, and also in diarrhea associated with AIDS. Okay, then octreotide is also used in treatment and prophylaxis of acute pancreatitis. Okay, now what are the other drugs which are used in diarrhea? So we have Resicadotril. Now resicadotril is a drug. It is enkephalinase inhibitor. Okay, so it inhibits the breakdown of enkephalins, right? Okay. Then we have another drug which is clonidine. Now clonidine is used in diabetic diarrhea. Okay. Then another drug which we have is crofelemer. Now this crofelemer is a new drug and it is used in diarrhea in AIDS patient. Okay. This basically blocks the chlorodyne channels in CFTR. Okay. Then there is another drug which is called as bezlotoxumab. It is a monoclonal antibody. Bezlotoxumab is a monoclonal antibody and it is basically used in Clostridium difficile recurrence. Okay. Then another drug is telotristat, also a new drug, and this is basically tryptophan hydroxylase inhibitor, right? And this is approved for diarrhea in carcinoid syndrome. Okay, that is telotristat. So these are the various drugs which we use in diarrhea. Now in continuation, let us see about ORS. ORS is a very simple topic, but इस पे questions आते हैं. Now ORS का हमारे पास आ गया है एक new formula, and in the new formula the concentration of sodium chloride, glucose and total osmolarity is reduced. Why? Because the old formula was made actually from cholera diarrhea point of view. Now the new diarrheas are mainly rotavirus diarrhea. So the old ORS was not very much fit for the diarrheas which are present now. So the concentration, this is the difference from the old diarrhea, old ORS. Then we also have some inflammatory bowel diseases, right? Now what are the inflammatory bowel diseases? We all know they are Crohn's disease and ulcerative colitis, right? Ulcerative colitis may we use sulfasalazine, and the active moiety of this is 5-ASA, which acts in ulcerative colitis. We know that it also gives sulfapyridine, which is basically used in rheumatoid arthritis. Then the other drugs in the same category is all-salazine and balsalazine. Then chronic Crohn's disease. So in Crohn's disease, the drug which is used are methotrexate. Then we have anti-TNF alpha drugs, in which we have infliximab, adalimumab, then certolizumab. Okay. Now infliximab is given by IV route, and these two drugs are given by subcutaneous route. Okay. Then other drugs that we have is, there's a new category which is called as anti-integrin inhibitors, right? Now anti-integrin inhibitors, the drug which we have is natalizumab, which is used in moderate to severe Crohn's disease. This drug has a risk of PML. PML is progressive multifocal leukoencephalopathy. Okay. Then another drug that we have is vedolizumab. This is again a new anti-integrin blocker, alpha 4 beta 7 in GIT. Okay. So so we have another drug that is vedolizumab. This is a new anti-integrin blocker. So this drug is also, these are new drugs which are used in the treatment of Crohn's disease. So now with this we complete the GIT. Okay, and now after this we are going to start with blood. We'll take blood, we'll take diuretics, and we'll take first those topics which we are going to complete in one day, and then we'll be taking CNS, the bigger topics like CNS, CNS is there, CVS is there, then antimicrobials is there, endocrine. So these topics, the big topics will be remaining then. Okay. Now taking important pointers of constipating drugs. सबसे पहले जैसे bulk forming agents are contraindicated in megacolon because that they will just deteriorate the condition. Then saline laxatives are contraindicated in chronic renal failure. Okay. Then stimulant purgatives are contraindicated in intestinal absorption because they can result in perforation also. So these are some important pointers from the constipation drugs. Then chronic use of anthraquinones. इसके ऊपर कई बार you will be given a photograph and you will be asked that which laxative is responsible for this. So anthraquinones, that is senna, they cause melanosis coli, which is basically what? That is a black pigmentation, okay, of the colon. Then phenolphthalein is not used now because it is carcinogenic. Then prucalopride, which is a 5-HT4 agonist. It is given orally and it is approved for idiopathic constipation, okay. Then we have drug which is lubiprostone and linaclotide, which we have seen in IBS treatment also. They are basically stimulants they stimulate the chloride ion channel and they are used in chronic constipation, right? So they stimulate the chloride ion channels and उनकी opening करते हैं in the intestine and that results in increased liquid secretion in gut, and they also reduce the transit time of the bowel. The bowel movement is fast हो जाता है. Then there is a drug which is called as plecanatide. This is guanylyl cyclase C agonist and it activates CFTR, leading to increased flow of chloride and water into the lumen of GIT, right? This drug plecanatide is approved for chronic idiopathic constipation, right? I never knew like so many drugs are approved for constipation. I mean, constipation is, I think, one of the most important illnesses that it has basically motivated the scientists to invent so many new drugs, right? I mean, constipation, the best drugs which were famous in our times were just isagol and bulk forming agents, and maybe purgatives were used just before the operation or in the purgation of tapeworms. उसके अलावा तो ये इतने नए agents अभी जो आ गए, so they are like prucalopride is there, then lubiprostone, linaclotide, then plecanatide. So these are new agents used in the treatment of constipation. In constipation, one thing that we have to remember is if it is an opioid-induced constipation, like there may be a patient who is addicted to opium or some kind of poisoning is there, then in such cases you can use methyl naltrexone. This is one, then naldemidine and naloxagol. So these are the drugs which are used in cancer-induced constipation.